And once again, congratulations for being on Wine and Just Media 100 list.
See, that was amazing, and it was even because of you that I found out. And I have to say that, when you're in the industry for as long as I've been, having other industry people recognize the work you put in, recognize the talent, and it sort of reestablishes you. It's good for you to have fans and people who listen, but when you also have people in the industry, they're telling you, we see what you're doing and we recognize it. It's a fantastic feeling.
I'm on your Twitter, and I remember just scrolling, and I saw your tweets. You said 745, 745, 745. No, I was interested about the numbers that you were talking about, and then the next tweet talked about how these numbers are going up and how you went out and you saw that people were not using their face masks. I wrote down the figures. As at 18th of June, the numbers in Nigeria were 18,480 confirmed cases, 6,307 people were discharged, and 475 people had died from the coronavirus. But
yes,
these numbers are going up. The lockdown has been relaxed, but people are not taking it seriously. I remember going to the market, and every single person, when I was wearing my face mask, I felt like the person who was overreacting to the pandemic. I felt like I was the only person who had this paranoia about the pandemic. So what do you think is why do you think Nigerians are taking this with some form of levity?
There's a lot of misinformation from the very beginning. I remember hearing that because we're black, we're likely not to get it, or because we're in the tropics, that temperature affects it. And while there's one or two studies on the temperature aspect of things, but it wasn't a complete blanket. It wasn't a complete blanket for us. And I just think it's just part of who we are as Nigerians. We have a distrust also for information that comes from the government, and it's not so much necessarily just of our faults, but that's a relationship and a dynamic to the relationship between the Nigerian and the government that has built over a long time. And it's one of the things that is actually, for lack of a better word, you probably might have to censor this, biting Nigeria in the ass when it comes to this issue of coronavirus. Because we heard that it's people who are immunocompromised, people who are a bit older, and we see that it has seemingly spared children, even though there are very young children and young adults who have gotten this, but majority, I think that has to be one of the saving graces of this virus, and something I discussed with Dr. Abimbola today, is that it spared children. Maybe the reality would hit many more people in the face if, knock on wood, children were victims and it was easy for children to get it. So I think it's just a number of factors: the Nigerian psyche, the relationship Nigerians have with their government, the lack of cases with children as well, and then people wanting to believe that they're somewhat immune, or initially it was also a rich man's disease, because the very first case was an Italian who traveled in, and then a number of the people of those cases were confirmed, were higher level, and people were like, okay, it's a lucky thing. It's because these people travel out. It's because they move about. So me that I'm here, my Sule or my Bule Agba, is it going to come to me? No. How am I coming in contact? And that was really before we hit community transmission. And that's one of the reasons the spread has been the way it is.
When the numbers that in Italy were on an epic rise, you could see the numbers and you could feel the fear from these doctors, you could feel the fear from these people. But do you think because we do not see those, we do not have pictures, we do not have videos as much in circulation, that's why there isn't that fear for the pandemic?
I don't know, because sometimes when I'd sit down and I'd watch international news and you'd see like military buses or vans or military trucks rather parked outside of hospitals in Italy, and they're loading dead bodies. I had a very visceral reaction. Someone like me, I don't need that to be next door for me to understand how it could be. But for many people, until it knocks on their front door, they're very reluctant to identify it or to even really say that this is something that's going on. If you've seen some of the research and some of the studies that have been done on what happens to COVID-19 survivors, and they have to be people, this disease absolutely ravages the body. it destroys the liver and the lungs. So you might survive, but for the rest of your life, you're dealing with breathing and respiratory issues. You're dealing with liver issues because of how this disease enters the body and through its pathology decimates the internal system. And there are people, and we've seen the situation with those who have to end up on life support or have machines breathing for them, how it's much worse for them. I don't know what we need, because we can't infringe on patient's privacy. It's a patient's decision if they want to come forward and say, I have corona. The issue of stigmatization came up when I was talking to the doctor today, and I think we just stigmatize everything to our own detriment in Nigeria. But we have to get to a point where it shouldn't have to knock on your door before you can believe that it exists. Life expectancy is in the early 50s for male and females in Nigeria. Many of us are 2-3 years away from a heart attack, high blood pressure. A lot of people already have high blood pressure. Even before Corona came, we'd hear stories of somebody was sick and died. Hear stories of somebody sat down and had a heart attack and died. Somebody slept and didn't wake up. So we already had, death is we're so desensitized to death in the country. And I also think it's partly because our life expectancy is low. People are walking around with health issues that they may not have money to treat. You now add that to the corona situation. So while our isolation space is an issue, there are some people who don't need to be isolated because their bodies will fight it. It is, at the end of the day, a virus. Viruses have time limits. The problem is, while it is in your body, what is it doing to your body, and what kind of body do you have? At the end of the day, it is a self-limiting virus that will end one time in your body, but while it is in your body, the damage could be deadly and fatal.
Daily, you'd see a message from the NCDC, you see a message for people living in Lagos, the governor of Lagos State. So, but now, no message. It's as if everybody just went home and just like, so you're like, is it that this thing
is this thing still here?
Is this something that we don't know? I don't know. So it's just me questioning how we are handling the situation. Why would they stop addressing people? Why would they stop coming out with the numbers? Even the NCDC numbers, you have to search before you just like. When you check people's statuses, you see it. When you check on Twitter, it's everywhere. But now you have to be deliberate about the search.
We have entered the period of personal responsibility. It is your personal responsibility at this point in time to make sure you keep yourself and your family as safe as possible. I think to some regard, government has done as much as they can. And in a way, it might feel like some of the governors are like, you know what, I'm done with these people. But we also the same people who it's true now, NCDC will release numbers. Last night, as I was watching and the numbers of retweets, immediately you go there, follow back. I follow for follow. Is that what we're talking about in the midst of a global pandemic? I follow for follow or follow back, whatever you call it. So there's also the issue of, they called it something fatigue. So there's the fact that your brain is tired. Do you know people are not washing their hands as much as at the beginning of the pandemic? People are not using sanitizer as much as at the beginning of the pandemic. And it's just, we're overloaded. We are fatigued. People are tired, and people are trying to find a balance to what is this new normal. So I think that plays into it a lot. NCDC is still, I still got an NCDC text message today. I get about 3 a week. From everything that we've heard from Professor Abayomi, I spoke to Dr. Abimbola as well today. From all the projections, our peak is expected to be July, August. Be somewhere between July, August. So right now, what we're seeing is still small. And I just want people to understand that we're hearing countries talk about second wave. We have not finished our first wave. The first wave of the coronavirus is not over in Nigeria. Mask up. So let's not just think about it in terms of our loved ones. Let's think about it in terms of our responsibilities to somebody else beside us.
All right. Thank you so much, Tolu.
You're welcome, Desmond. You owe me like dinner or like cupcakes or like I don't know what. And you know, I've told you to have me. You know you should have me on this show. I've told you that. Don't worry. See, Desmond is family. Don't worry.
And do oblige me when I reach out.
Definitely, I will. Have a great day.
You too.
All right. Bye.
Hi, my name is Omom. I just want to inform us that we haven't yet defeated the COVID-19 pandemic as a country. NCDC is still reporting new cases every day. I want to encourage us to please maintain social distancing. Don't leave your house except it's absolutely necessary. Use your face mask if you have to leave your house. Remember to wash your hands regularly throughout the day. Also, eat healthy and maintain a healthy lifestyle.